Hi, my name is Charit Hodagode. I'm a respiratory physician in Western Sydney, and I'd like to talk to you a little bit about chronic cough. Now, chronic cough is defined as cough lasting more than 3 weeks, and there are many causes for it. It's a very common symptom that bothers many people, and I see lots and lots of patients with regards to chronic cough. Now, chronic cough chiefly, or the most common causes of chronic cough come to asthma, postnasal drip from chronic rhinosinusitis, and reflux-related cough. There are less common coughs, such as sensory neuropathic cough, which also occur fairly often, which people also suffer from. Now, if you suffer from a cough that lasts longer than it should, it's gone for 3 weeks and it's not getting better, you ideally see your GP, and your GP then refers you to see a respiratory physician. We first rule out any sinister or dangerous causes such as cancer and chronic infections like tuberculosis, and once they have been excluded, we then work on whether you have one of the three common causes of cough, namely asthma, chronic rhinosinusitis and postnasal drip, or gastroesophageal reflux related cough. This involves a detailed history. We'll examine you. At Complete Health Australia in Western Sydney and Rousseau and Norwest, we perform a rhinoscopy and have a look at your nasal cavity and your larynx as well as part of the workup for your cough. There may be further investigations, which may be imaging, such as CT scans of the sinuses and the upper airways, and we may end up doing blood tests to look for allergies as well. You may end up doing a lung function test, which we have facility for at Complete Health Australia, and this will aid in us diagnosing your cough. Once we do make a diagnosis after the history and investigation, we then move on to treatment. And the treatment, of course, depends on what type of cough you have, whether it be asthma, chronic rhinosinusitis, or gastroesophageal reflux disease. All of these have good treatment options, and one of the more up-and-coming ones, which is called sensory neuropathic cough, which involves damage to the sensory nerves of the larynx or the throat because of violent regular coughing. There are certain new treatments that are now coming out for this type of cough as well. So if you would like to talk further about your cough, or if you do suffer from chronic cough, I would be more than happy to see you at Complete Health Australia. Thank you.